Hi there, I'm Shauna Robbins, founder and CEO of Third Spark. And today I have with me Dr. Philippa Kaye. We are going to be talking about thriving through menopause, wellness tips for women over 45. Dr. Philippa Kaye is a UK-based GP, a media doctor, a journalist, and an author. She has written multiple books, including an Amazon bestseller, Doctors Get Cancer Too, The M Word, and DK's Breasts, an owner's guide. Her latest book is called The Science of Menopause, and it'll be released next week for World Menopause Day. Thank you for joining me today, Dr. Kaye.
Thank you so much for having me.
Yay. Can you tell me how you first got involved in women's health and wellness and what your background is?
So I'm a GP by trade, which is a family medicine doctor in the UK. And the reason I got into it is because when you were doing hospital medicine as a trainee and you go around each of the different specialties, I thought I could live here. I could live here. I could live here. I could live here in everything apart from orthopedics. The thought of holding a leg all day was really not for me. But everywhere else I thought I could live, and general practice allows me to do that. And then what was really clear to me is that I am fascinated by women's health, sexual health, and children's health, and how society and culture and history and religion and all of that plays into it. And the more that you learn, the more that your patients will begin to self-select towards you in general practice, where they could choose to see all kinds of different doctors. And the need to start writing was born of a time, and it makes me sound tremendously old, and I'm not, but 20 years ago, Google wasn't used in the same way that it's used now. And there used to be a parenting book here called Dr. Spock that everybody had on their shelves, all my parents' generations had. And when I did PEDS ER, I was like, but all these parents are coming in with their kids with a fever. We've lost the village. We've lost the ability to ring your mum who lives over the road and say, my kid's got a fever. What do I do? And people were coming to the ER. And so I thought, oh, I'm going to write a book. And wrote to a bunch of publishing houses. And that's how I got my first book. And from there, I got magazines. And from there, radio, TV. But for me, the menopause was a really obvious choice for my first menopause book, which was over 5 years ago. And that's because the menopause space has changed an awful lot in the UK in the past 5, 10 years. But it was still the subject, and in many parts is still the subject that is not spoken about. And whilst women currently are going to live about a third of their lives after the menopause, probably in 20, 30 years, they're going to live half their lives after the menopause. And quite frankly, I don't want to live that half of my life being told I'm past it and that's it, game over. And so for me, this was about empowering all the women that I can't get to see. If I can see 30 patients in a day, when I go on telly, I can hit hundreds of thousands of people. And with a book, I can hit many, many more. And that was my incentive to writing it.
Oh, that's amazing. I'm wondering what the difference is between the UK and the American system. I know in the American system, it's very challenging to find doctors that have a menopause training, menopause background, being even able or open to prescribing HRT for women after the Women's Initiative back in 2002 that said that, estrogen causes breast cancer. And the physicians in the US just, closed up shop as far as prescribing estrogen. So tell me what you think are, some of the pros and cons of the system that you are working with, versus, what those of us in the US are trying to struggle through as well when it comes to, finding support through menopause.
So, menopause was not taught in medical school apart from what is the menopause, full stop. I did obstetrics and gynecology as what the equivalent of a resident doctor would be over there. And I did not do anything related to menopause at all, apart from postmenopausal bleeding being seen as potential uterine womb cancer. And so it was only when I got to general practice that I began to see issues related to it. But that's actually true of a lot of areas of medicine that don't actually reach the hospital. Things like contraception, for example, they're dealt with in what we call primary care. Now, in the UK, we have the NHS, the National Health Service, which is free at the point of access, and that's the biggest advantage. But I hate to say it's not working tremendously well in many, many areas. but in particular when it comes to menopause care. And there are what we call postcode lotteries about access to drugs depending on where you are around the country. It's very dependent on the GP and the GP practice that you have. And if you live on the border of various different counties, or I guess the same would be states over there, that you can have one GP practice that the GPs are able to prescribe, for example, testosterone. Go 2 miles down the road, they can't without seeing a menopause specialist, and the wait for those can be 18 months to 2 years.
Wow.
And so it's very variable, and that's a problem. And I think that we need to change more towards menopause care being bread and butter for general practice in the same way that contraception is, or childhood immunizations are, or something like that. And we're moving, but it's slow. And the guidelines come out, etc., etc. And people always say, well, how come doctors changed their mind? Were they lying to us? Were they lying to us when they said HRT or MHT is safe? And then in 2002, the number of prescriptions here plummeted. And now you're saying, well, actually, for most people, it is safe. No one's lying. All it is that we changed the guidance according to the data that we have. And women's health research has been chronically underfunded for millennia. It didn't even really exist before. And where we don't have data, we need to be honest about that and say we simply don't know. And that's often where there are issues with regards to misinformation, and social media will just plug those holes with a load of non-science or nonsense. Um, and so it's very difficult for lots and lots of people. There are some big changes here which I think are really valuable. The first is that menopause is now included in the personal health and social curriculum that is in secondary schools.
Mm.
So there is a national curriculum that is set by the government, and that includes things like learning about puberty or smoking and alcohol and drugs. And now, when you learn about sex and contraception, you will also be learning about menopause. And that's great. But those kids are 14, 15,
Right.
16. That means
Right.
that we have a whole generation of people that still don't know. But that's how you begin to make change. And that is taught to all genders,
Mm.
because there really shouldn't be such a thing as women's health. There's just health, because everybody has a mum, a sister, a friend, a best mate, a work colleague, whatever it may be. And we need to know about each other so that we can support each other. But there is an awful long way to go.
I really like that. There shouldn't just be women's health. There should just be health. That's such a good concept, I think, in this day and age where gender differences are such a factor. You know, you hear about
Mm.
like female CEOs versus CEOs, you know, women leaders versus leaders. You know, I agree with you. I think the language around that is probably the first place that we need to start by making a change. And then
And
education.
as I sit in my surgery, the number of times a woman comes in and they say, I found a breast lump. And I say, how long has it been there? They say, I don't know. My partner found it. I don't examine my breasts. And I say to a gentleman, how long have you had whatever you've got, change in bowel habit? And they turn to their spouse and they say, what do you think? How long have I been complaining, right? We look after each other. We are pack animals. We don't like to think of ourselves as animals, but we live in a herd. And so we have to be informed about each other. And there is a shift, but it's very gradual. And when I give talks at big commercial organizations about menopause. And so, for example, there's a big pledge here about menopause in the workplace and having policies in place. So, for example, if you're on a factory floor that you can go to the toilet when you need to go to, then maybe your uniform isn't made of polyester so that you're not sweating. Um, so I will say, I can't see you all necessarily if we're doing it online. Put your hands up in the chat if you identify as male. Put your hands up in the chat if you identify as senior leadership. How many of those numbers cross over? Because the truth is that there are still more men in senior leadership positions. And if you are a woman in menopause, perimenopause, menopause transition, and you need to approach your line manager, they need to have a clue what you're talking about.
Hmm.
So we all need to know.
Yeah, well, thank goodness your book is going to be out next week so that it keeps having these important conversations. So tell me the overview on your book and tell me where women can find it and, you know, what you hope to share, advocate, educate, you know, what are the goals for this?
So for me, education is empowerment. It's not scaremongering, okay? It's empowering. And I always wanted to be, well, no, I'm going to give my mum credit. My mum was always like, Philippa, you need to be the girl in the playground with the answers. When there's like a rumor about where babies come from, where there's a rumor about what your period is, right? You need to be the one that has the answers. And this book is going to make you the girl in the playground with the answers. So that when something happens, you are able to connect the dots because many of the signs and symptoms of the perimenopause can be quite vague and they can have lots of causes, you know, fatigue, insomnia. And you need to be able to connect those dots and then go to your doctor. And when you are presenting to your doctor, especially in a world where it can be challenging to see your doctor, and over there where it costs to see the doctor, and we need to use that time effectively, and then we want to have access to the right thing, going armed with guidance, saying, actually, this is what it says here. Tell me why you disagree, is really valuable. The book was written with the British Menopause Society, the North American Menopause Society guidelines, the NICE guidelines, the International Menopause Society guidelines. I made it absolutely as global as I could because I need to help as many people as I can. And really importantly, it talks about people of different ethnicities. And if we don't have enough research about menopause in general and women's health in general, it's even more lacking when we talk about people of different ethnicities. But where we do know information, and we have a huge study that was from America called the SWAN study that gives us information, for example, that Black women might be more likely to present with one symptom than another, and Latina women with one symptom than another. And so that you know potentially what might be happening to you. As a doctor, I'm never upset when somebody comes with something pulled out of the newspaper or a book. It's an opportunity for us to talk about it together. And what I feel is really special about this book is that it is absolutely filled with infographics and illustrations. If a picture can paint 1,000 words, it really explains the science in a way that is easy for you to understand. Because once you understand what is happening to you, that is the first step to getting help. And all the different health options are in there, including menopause hormonal therapy, but also non-hormonal prescribable treatments and lifestyle options and herbal options and talking therapy and all of that in between. So I'm hoping it is a one-stop shop.
Ah, amazing, just amazing. Now you touched a little bit upon lifestyle changes during menopause. Can you talk a little bit more about that? Tell me what you would recommend to a, you know, a patient who came to see you who maybe didn't want to try hormone replacement or wasn't
Mm.
able to for whatever reason. What conversation would you be having with her?
So the first thing is that it's never lifestyle or medication. It's always, and it doesn't matter if we're talking about hypertension or high cholesterol or a heart attack or whatever it might be, it's never either or. It's always lifestyle and if you need it. So I wish that I had a magic pill that meant that you didn't have to do anything, but unfortunately we do. So lifestyle makes a really big difference. Physical activity, it doesn't really matter if you aren't good at it. I'm not good at it. It just matters that we do it. And actually, weight bearing exercise and muscle strengthening exercises will not only protect your bones, but it improves fatigue. It seems sort of counterintuitive, but when you're tired, exercise actually gives you energy. It improves insomnia. It decreases hot flashes and night sweats. um, it improves mood and anxiety. You know, the list goes on and on and on. So exercise is hugely important. Looking at your diet. So for some people, for lots of people, alcohol will worsen flushes and sweats. It will worsen your sleep. It will worsen fatigue. It increases your risk of breast cancer significantly. And people always worry about the risk of breast cancer with HRT, but actually smoking and drinking alcohol and having obesity and not exercising all increase your risk of breast cancer. And people don't really talk about that in the same way. So, looking at alcohol, smoking, caffeine, spicy foods can trigger hot flashes and sweats for some people. But I always also view this as an opportunity to say, what can I add? When people talk about diets, they always seem so very restrictive and boring. And you think, well, how am I going to stick to this? But actually, if we change our mindset to say, what can I add? So, for example, the average person in the UK has about 18 grams of fiber a day. And in the US, it's even less than that, whilst the recommended target is 30 grams. So, adding in fruit, vegetables, nuts, seeds, pulses not only will increase that fiber, which is beneficial, decreasing your risk of bowel cancer, etc., it affects your gut microbiome. Your gut microbiome both produces and is influenced by estrogen. So, there's a potential role there within the menopause, keeps you fuller for longer, which means you're less likely to go and eat something else. So, diet and exercise and all of those things are really important. And I also put within lifestyle things like stress management, making sure that you attend your screening programs, be that breast screening and cervical screening. This is an opportunity to look at all those things. When it comes to supplements, there is evidence for some things, for example, vitamin D in the Northern Hemisphere. But there are a lot of menopause supplements being sold out there that don't have evidence for them. Loads. And when we aren't feeling our best, we're vulnerable to those, right? We're
Right.
vulnerable to, there's a brand here that sells menopause chocolate. And it's a fortune. It's like £5 for a bar. So about $6.5 for a bar of chocolate that
Does it
doesn't have
have
any
anything in
evidence
it?
that it works.
It doesn't have anything in it. It's just chocolate.
It's
Marbled.
chocolate that's got some herbs in it, but there is no evidence that it works at all. That there's the menopause industry is huge, and menopause pajamas, which are quite frankly just simple cotton pajamas, at 3 times the price of a pair of cotton pajamas.
Wow.
Menopause face cream, which is just the same as other face cream. We don't have active ingredients that are just for menopause, and this is all just another way of taxing women. So I think that lifestyle is important, but that doesn't mean that you need to go and spend a fortune on it. But if you, and I think that we need to look at lifestyle whether or not we are taking hormonal therapy. And that also includes things like good lube for sex, lube that doesn't contain glycerin and isn't scented and doesn't affect the pH of the vagina and things like that. If you don't want or can't have hormone replacement therapy, then we have non-hormonal prescribable options. We have things like antidepressants and anti-seizure medicines, and that doesn't mean that I think that you're depressed or have epilepsy. It means that we can use them for hot flushes and sweats as well as psychological symptoms. We have newer medications. One of them is called Veoza, and that works on how a hot flush occurs. We have treatments that can be used for urine symptoms, all kinds of things. And cognitive behavioral therapy, which is a form of talking therapy, which has evidence for not just anxiety, depression, insomnia, but also for hot flushes and sweats, which is fascinating.
Mm.
So we have lots and lots of different options. But even if you can't take HRT, most women can take vaginal estrogen.
Mhm.
And vaginal estrogen
Mhm.
treats genitourinary syndrome of the menopause. And symptoms of that are dry, itchy, sore, burning vulva and vagina, painful penetration, and recurrent UTIs. And whilst in your 40s, you might think a UTI is annoying and sore. As you get old, one, they can make you sick. Of course, they can make you sick. But as you get older, little old ladies with UTIs fall over and break their hips,
Right.
or they become delirious and they become really sick because of that. And vaginal estrogen really helps stop all of those things, and it is absolutely safe to be on in the long term. Taking vaginal estrogen for a whole year is about the same as taking one single tablet of HRT.
Mm.
It doesn't get absorbed into the body in the same way. So even if you've had breast cancer, for example, the Royal College here and all over the world says that taking vaginal estrogen is safe. So don't think I don't want hormone replacement, therefore I'm not going to go to the doctor, because I have loads of tools that I can use to help you.
Amazing. Amazing. Women just need to know what they need to ask for, what they need to advocate for, and then they have to feel empowered enough to speak up to their doctor, maybe a doctor that might be dismissive or gaslighting, or for me, I know I had to go to 5 different doctors before I
Oh
finally
gosh.
found a prescription for menopause hormone replacement. And it was challenging, but I think the more we talk about it and what you're doing by providing the information for women so that they can have these educated conversations with doctors that hopefully become more open-minded and more available to women. The whole process, I hope, is going to change for my daughters and their generation and my granddaughters. So thank you for everything that you are doing to make a difference for women in the world. I really appreciate all of this, and I appreciate you spending this time with me.
Thank you. And I think that I really appreciate you saying that, but I think that some stereotypes about women are true. And one of them is that women talk. And so when you have this correct information that is in this book, that means that you are able to take it and share it with your friends and share it with your family, because it is us that is going to make the difference to the generation that comes below us. And never be afraid to take a book like that to your doctor and say, do you know what? There are about 20 pages of references in here. Tell me why you disagree. And my job is 2 things. One, to know some stuff about stuff, and 2, to be nice and be able to communicate that with you. So if I can't communicate with you why HRT isn't appropriate for you, then I've failed in my job, right? So if you were to challenge me and say, but why can't I have it? If the answer is because you're allergic to it, then that's something that you can understand, right? And I think that there's this idea that women can't understand, and that's just completely wrong. So get empowered, get informed, and that will be what will give you the impetus to then be able to challenge your doctor. Doctors are learning all the time too. So I really appreciate you sharing the word of science of the menopause.
Wonderful. Dr. Kaye, where can we find your book? Where will it be available next week?
It will be available everywhere in the US on Amazon from all good booksellers. And I very much hope that you'll put a link down below so that people will be able to find it.
Absolutely, that will be done. Thank you so very much for joining me today.
Thanks, Shauna.